limited, so I'll just remind people of the guidelines. You're going to be muted. If you have a question, put it in the chat, um, or raise your hand. And we have two exciting talks in this section. And we've got, and I'm going to apologize now if I'm mispronouncing your name. We have Joel Tremblay from the Department of Psychoeducation, University of Quebec in Canada. He's going to be talking to us about addiction research with the family in Quebec. Then we have Max van Beek from the Gelneck Prevention and Treatment Organization in Amsterdam, in the Netherlands. So two exciting talks. So we're going to begin with Joel, and I hope you're here. And I don't want to take up any of your time, 15 minutes, and then hopefully it's going to leave some time for questions.
Okay, do you hear me?
Yes, we hear you, indeed.
Okay, let me share my slides. Richard, I think I share myself the slides. I think so. Let's start.
I think if you can, if not, we can do it. Yes, I think if you
I
can
do it in a few seconds. Let me just start it.
And Jeff, if you could turn your video off. Thanks.
Okay, now. Okay, do you see now the slides?
Yep. Yes, you're sharing it.
Everything is okay. I can start?
You can start.
Thank you for the reassurance. So, hi everybody. I'm Joël Tremblay from Canada, Quebec City. I will talk to you, and I'm a psychologist, and a professor at the Université du Québec at Trois-Rivières, and I'm conducting many research projects, clinical research projects on family members of persons having difficulties with substances or gambling. As I talked with Richard before, I will present briefly three fields in which we are conducting research projects. First, I'll talk about our couple therapy program. Another topic will be the development of a new assessment for family members, and also a quite innovative project we had with one of our doctoral students, an intervention with family members of persons affected by schizophrenia and substances abuse. And let me start also my chrono just to be sure I'm on time. Okay. So, let's talk about our couple treatment. So we call it integrative couple treatment in addiction, described in different papers, where we conducted the first randomized study for gambling disorder. So couples versus individual treatment. So we integrated couple with one member having huge difficulties with gambling. We observed, and we are now submitting our papers for publication, the superior efficacy of couple treatment on gambling indicators, but also on individual distress and on couple functioning. We published already a qualitative study on where we observed these results from a qualitative or subjective point of view, but also we observe it in our different measures we have. The very interesting result, one of the very interesting results, is that we observe a long-term efficacy over 22 months. So we note that couples or gamblers who went into couple treatment improved more and kept their improvement over 22 months. But moreover, we have these improvement are more important for the partner who also improve for this long period of time. I must mention that both treatment are efficacious, but there's a superiority of the couple intervention. We don't know exactly which part of the treatment is causing this efficacy, this superior efficacy, but globally the fact or the practice to include both member of the couple into the treatment is provoking some very interesting results. During this long process, because it was a very long research project, supervising many group of therapists, we observed how intense was the broken confidence into the couple. And we noted that we need to improve our model by working more on the restoration of the relationship. There's something broken in the attachment link, and we are working on the concept of forgiveness, not as a state, but as an umbrella describing many small processes useful in the restoration of the relationship. We are including it actually in our model. One of our brilliant doctoral students published a scoping review on this topic. We have actually a new grant for 5 years where we start a new randomized study, efficacy study, with couples with one member being affected by gambling, but also by substances, a kind of comorbidity into the addictions, where we will include in our new, our improved model, these elements of forgiveness, but also elements from the emotionally focused couple therapy from Sue Johnson, who is from Canada too. So we work with her team to improve our model and give a stronger portion of our intervention tapping on attachment questions into the couple. We also will have 3 pilot sites, one in Barcelona, another in Switzerland, and in Sweden with the colleagues you see on the slides, where we will go through this question, must we go through cultural adaptations for our couple treatment? We observed, for example, that Barcelona family members want to be into treatment, and colleagues over there say we have difficulty to keep them apart from the treatment. But in Sweden, Dr. Akansson says to us that it is very difficult for them to include family members. So we think there's some cultural aspects that we need to take into account. So this is our a big part of our research activities on family members. More rapidly, I'll talk to you about another part of our efforts is to improve the assessment we have for family members. At least here in Canada, and specifically in Quebec province, we observe that when family members arrive into the services, ask for help, we professionals don't have any kind of structured assessment where they can have a kind of picture of the psychological and relationship situation of the family members. So it is another grant we have. So, and the goal is to have a better assessment when people are arriving into the services in order to improve the intervention we will have. So we include into this new assessment anything that can be useful for intervention. Otherwise, we don't include it into the assessment. So we have a list here of different elements we will include. So general health aspects and resources, relationship quality, severity of the addiction of the loved one, consequences of addiction on the family members, beliefs about addiction, rehabilitation, and the role of family members, and also aspects on violence and coping strategies. We target parents, spouses, adult children, and other people. So this is a in-progress research grant. And sorry, I go back to my slide, and the goal is to structure the services offered to family members, because we observe into the province that there is high discrepancies between services available into one area or the other, depending on the beliefs and the decisions different stakeholders took about services to family members. So by structuring the assessment, this is a first step to be sure we have a well-organized service everywhere on the territory of the province for family members of addicted persons. And finally, looking at my time, finally, we have another project quite interesting and innovative, which is a group therapy for parents of adults with schizophrenia and addiction to substances. One of our other excellent doctoral student, Karine Gaudreau, she will defend her thesis this year. She's a social worker, and she developed with therapists, but also with parents themselves, a program based on many programs are already existing, but schizophrenia mixed with substance abuse create a very difficult situation. These parents talk about responding, and when we assess how embedded are they into supporting the family member suffering from schizophrenia and substance abuse, we observed, for example, that they spend at least 5 hours a week. Even if this adult is 40 years old, they still spend at least 4 hours a week, not only for having fun or lunch or visiting, but for support, direct support to this family members. They report a mean of 15 different requests a week, help request, the helping request by this family member, and this is for a lifelong duration. On the other side, there's absolutely no services for them unless with their adult child. So every hospital we know here in Quebec Mental Health Hospital, they say we offer services for family members, specifically parents, only if the person affected by schizophrenia and substance abuse is into the services. But they are not not always consulting. As soon as they are not consulting anymore, family members cannot have services. So I outline rapidly the topics covered by the program called the recaps. So many generalities for 2 sessions, knowledge about schizophrenia, but also about substance use disorders. A quite important session on communication, and followed by principles of motivation. How can you interact differently with this family member? And when we went through qualitative interviews with the person affected with schizophrenia and addiction to substances, they themselves reported that how pleased they were that their parents were not anymore putting pressure on them. They were rather trying to understand their situation, why they are using substances, what is the function of substances into their situation, and just spending time with parents, helping them to adopt a different attitude toward their son was reported subjectively by the other family members as very positive. As Yalam said, sharing experience, the same experience with other people is very useful. Spend time to enrich your own life. All these parents said, I cannot take care of myself. Look at my son, how difficult is his situation. How can I complain about anything on my life? But on the other side, they were highly depressed. They had suicide ideas, and they were in a very difficult situation. How can they manage crisis, psychotic crisis, suicidal crisis, substance overdose, and ask for support? Bref. So these are the topics. So the main results are, and I'm quite close of my time frame, I think, Richard. I still have 1 minute, I think.
You're doing well. You have 1, 2 minutes to finish up, and we're here to hear questions. Thanks.
Yeah. Okay. Excellent. Excellent. So I'm done. I'm nearly done. Just finished that slide. So the main results are the program is well received by therapists and by parents, and peer support is strongly appreciated. And one of the very interesting observation, mainly for research too, is each one improved, but on different domains, because we can read different studies showing that these kinds of programs don't have any efficacy, but they take only one variable and they ask everybody, do you improve on this variable by some questionnaires? But what we observed is each one improved, but on a very idiosyncratic variable, on his specific needs. So one improved on being able to better communicate, and it really helped a lot. Another improved on taking care of himself. Another improved by being very open to listen to other experience. So it helped us to shift our way to approaching these kinds of program. But so what did I say? So, and what they also mainly said, they need more. 10 sessions for something that is a lifelong problem is very poor, or this is not poor, but this is not enough. So they need diversified interventions, they need more peer support, and we must separate the help to them from the help gave to the person suffering from schizophrenia. So I'm done. Let me stop the sharing process.
Thank you very much, Professor Tremblay. That was really fascinating. And I don't see any questions in the chat yet, but hopefully they'll generate some. I've got a question that's kind of burning in my mind, because I heard a similarity and a parallel to what Jeff was talking about, in terms of if family members, if the family was a key, draw to get people into treatment. It's interesting in the couples therapy, with a quite a good outcome, the improved attachment, the improved forgiveness. And I know you were saying you weren't 100% sure of the factors that led to that sustained improvement, but I am wondering, in terms of, were there any measurement of the quality of the relationship pre and post?
Yeah. Of course, we had measures on the addiction, the addicted behaviors. We had questionnaires on quality of the relationship, and questionnaires about the well-being, the individual well-being. So the point is, they improved on all of these, on many of these indicators, but can we identify specific interventions that could explain mainly these improvements? My point of view is because with the qualitative aspects, we observed that family members said things like, "Oh, now I understand his problem. Now I can help him." When one of our main goal is to help the addicted person to talk to his or her partner about craving, about relapse behaviors, and then we create a kind of family support. Instead of hiding the addiction, we say, let's talk about it. Only talk about it. That will work, and then you will have support instead of hiding yourself.
Excellent, thank you. And I see a question coming in. Could you elaborate a little bit more on the coping strategies by family members, along with the severity of the substance use?
Yeah, we conducted different works, and one of our students published 2 excellent papers on coping from family members. And so mainly we can artificially think about coping strategies from family members that can help to reduce addiction, and other strategies that perhaps provoke and more addiction behaviors. In fact, we think that the picture is part of grays, and some strategies from family members are sometimes helping to reduce addiction and sometimes not. So we think about things like listening, trying to do not use any alcohol in the home, at home, or and letting the other one live his own consequences of behavior if it's not too damaging, things like that.
Excellent, thank you. I think we have time for one more, question. And I see a request for the links to those papers, and I also saw a request for your email address. So expect a couple more questions coming personally from this. Are there any more questions? Because I've got one more to finish up, and then we need to move on to Max. One of the things that you were saying, and again, I'm going to go back to a parallel with what Jeff was saying, that a common theme you heard was family members had a broader understanding of what they were living with, whether it be the addiction or the mental health issues. And from a psychoeducational point of view, were there specific materials you used or an approach you used to, and maybe what you just said is you help people listen more?
Yeah, one of the main observations we have is, for example, many partners reported that their explanation of the addicted behaviors was intentional. He is doing it to hurt me. He is doing it because he doesn't love me. But by listening and by just having the possibility to say it to your partner, the partner can say, no, I love you, but it is stronger than me. I cannot stop myself. Just this kind of small talk about real intention relax many tensions into the couple. Just saying, okay, you love me, but this is stronger than you. Okay, this is not a kind of attack to our attachment link. This is something else. So, and this is hard for people to just read it in a book and transform their beliefs. It's more effective when they are in front of their family member and they can talk about it and receive and listen to the real intention underlying the addicted behaviors.
Okay, that's excellent. Well, I can't thank you enough, for your presentation, your efforts, and some of the thoughts. So thank you very much.
So thank you for the invitation. It's a privilege.